Welcome everyone to the July 10th, 2023 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwiazdowski-Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Jennifer Maynard.
Jen Maynard present.
Dan Finn.
Dan Finn here.
Austin Magnet.
Austin Magnet is present.
And Bill Muller.
Bill Muller here.
All right, it always messes me up because I go in order of who I see. So sometimes it has longevity, sometimes, yeah, I don't know. I just feel it's the easiest way to do it. Staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. I don't see Nancy yet. I think she's supposed to be joining us. She might be logging back on. Micah Blondeau.
Micah Blondeau here.
Amelia Houghton.
Amelia Houghton here.
Jennifer Nakajoba. Apologize if I pronounce it wrong. Trust me, as someone with my lovely last name, I apologize.
Panachijova here.
And I didn't see, I know we invited Brendan Keenan and Solo also, not knowing who was going to attend, so we figured more was better for invites. I'd like to open the meeting. Can I get a motion from one of the board members to open the meeting, please?
Yeah, this is Dan Finn. I'd like to make a motion to open this meeting.
Is there a second?
This is Austin Magnet. I'll second the motion to open the meeting.
All right, and then board members roll call vote.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwiazdowski-Govin, aye. All right, good evening once again. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the act extending certain COVID-19 measures adopted during the state of emergency in Massachusetts. This act includes an extension now until March 31st of 2025 of the remote meeting provisions of prior Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. All right, the order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. The Grafton Board of Health is convening by video conference this evening via Zoom, fully remote, as posted on the town's website, identifying how the public may join. Please note the meeting is being recorded, and so anything that you screen share, say, or have on your in your background can be visible and will be picked up by the recording. Also, please be aware that you keep yourself probably on mute, I would say, unless you're speaking, just because there's always the chance of background noise, and to help when Nancy's generating meeting minutes for us. Any supporting materials that have been provided to the members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Just a few other tips regarding the ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes again. I'll introduce any speakers on any agenda topics. After any remarks have been made, I'll open it up to the board members to ask any questions, comments, etc. As always, please identify yourself by name when speaking, because some people might be just joining by phone, so they won't be able to see who's speaking at the time. I've already mentioned about muting, whether it's your computer or your phone, and then please remember to speak clearly, so that way it helps with generating accurate meeting minutes. And then finally, any votes on any motions made during this meeting will be conducted by roll call vote. All right, so with that, let's kick off the agenda. So the first topic, it looks like, is reorganization of the board. It is that time of year already. Somehow we're already in July. Dan.
Yep, this is Dan Finn, and I would like to nominate Karen Gwiazdowski-Govin as the Board of Health. All right, you got it pretty.
Got it right.
As the Board of Health chairperson for the coming fiscal year of 2023, 2024.
This is Austin Magnin. I'll second that nomination of Karen Grostowski Govan to Chair of the Board of Health.
All right, roll call vote if there's no discussion.
Yeah, hold on 1 second.
Dan Finn, aye.
Austin Magnin, aye.
Bill Muller, aye.
Jen Maynard, I.
I'll abstain. Be a little weird to vote for yourself. Thank you, everyone. Yes, Dan.
Yep, this is Dan Finn again. And I should have checked with Jen prior to taking this liberty, but I would like to nominate Jennifer Maynard as Vice Chair of the Board of Health, the Grafton Board of Health for this coming fiscal year, 2023, 2024.
This is Austin Magnin. I'll second that nomination of Jennifer Maynard to co-chair.
All right, roll call vote if there's no discussion.
Dan Finn, aye.
Austin Magnin, aye.
Bill Muller, aye.
Karen Gostowski Govan, aye.
I'll abstain. Jen Maynard. Thanks, guys.
I got one more.
Dan.
This is Dan Finn again. And not to snub Dr. Bill Muller, however, and I should have checked with Austin, but I would like to take the liberty of nominating Austin Magnin as clerk of the Grafton Board of Health for the coming fiscal year of 2023, 2024. Think you have enough titles, Bill?
This is Jen Maynard. I'll second the nomination for Austin Magnet for the clerk of the Board of Health.
All right, roll call vote if there is no discussion.
Dan Finn, aye.
Jen Maynard, I.
Bill Muller, aye.
Karen Gostowski Govan, aye.
And I will abstain.
All right, well, thank you, everyone. Easy, those are always the easier topics. All right, going on to another pleasant topic as the Alliance update. So Micah, Amelia, who wants to go first?
I can go first. I don't have a whole lot of updates. It's been fairly quiet. I did do one foodborne illness investigation at a restaurant here that I didn't find any reason that it would be a founded complaint. We had no other illnesses and no other reports for that location. We got the farmers market all up and running with all the vendors.
I know that is definitely a process, to say the least.
It is just trying to wrangle everybody in and make sure we know who's coming and that they're all got their paperwork and everything. So Nancy and Beth did a really good job on that, and we were able to get everything rolling pretty smoothly with that. And we'll be, I think, trying to improve the process as we go along. And other than that, I believe we have one possibly new body art establishment coming, and one change of use for the Grafton Flea Market. They're trying to expand their menu, and we're working with them on that. So that is all my updates for now.
Thank you. I was happy to see that. I was at First Bite Cafe, because that's in my part of town, not right in my neck of the woods, but I was happy to see. I drove by and saw that looks like someone else is either taking over ownership, opening it up.
Yes, it
Something.
changed.
At least it didn't
changed
go
ownership.
empty. And
Yeah, and they have they definitely spruced the place up quite a bit, and with the new owner we were able to make sure some of the changes we want in there got done, so it's much cleaner, much more organized, and hopefully the new owners are doing well, so we'll be checking on them.
yeah, I haven't seen it from the inside. I just know I saw the outside driving by. I was like, oh, good. Someone, it's always, you get sad to see when something closes. And
Yeah, I don't think we've had too many closures so far, so it's looking good.
Dan?
Thank you, Karen. This is Dan. Mike, I just have one question. is the farmer's market still held on Wednesdays? And is it at the municipal center now and not the town common, not the Grafton Common? Or is it on the common?
As far as I know, it should be on the common on Wednesdays.
Okay, good, thanks.
I know, I've lost track of which location it was. It's bounced a few times, so. All right, any other questions from Micah before we jump over to Amelia? All right, seeing no hands and everyone's on mute but me, then Amelia, the floor is yours. Thank you, Micah.
Hi, thanks, Micah. So just an update on our blood pressure clinics. So as you know, we run blood pressure screenings once a month in the senior center, once a month in the Housing Authority office, and once a month at 10 Maxwell Drive, the actual office, the Housing Authority, and on Forest Lane, and then the Housing Authority office on Maxwell Drive. So that's 3 per month. So the month of June saw 14 participants for the senior center, nothing for Maxwell Drive, and 2 for the Housing Authority, which they average 2 to 4 a month.
Okay.
So we'll continue to watch Maxwell Drive to see if maybe that's not an optimal location, or maybe we have to add hours to the other locations. But we'll just give it a couple of months to see what happens.
Yeah.
And then we'll figure it out. We'll sit down and figure it out.
No, it makes sense, because if you see consistently 0, 0, 0 or something over a period of months in a row, then maybe.
It's been, yeah, I agree. It's been 0 for most months and maybe an occasional 1, but I think that may have been with some incentive. So I need to just kind of look at it carefully and see if this is a pattern, if there's interest, and maybe we need to survey to see if there is interest
Yeah, I was thinking
to
that, like,
begin with.
yeah, maybe almost like you said, survey to see, is it
Revisit.
time
yeah.
it doesn't work? Is it everyone's they go to one of the other ones, or they're going to their doctors on a regular basis, so they don't need it? I don't know.
Right, so we'll dig into that. We'll figure that out. So that's in terms of the blood pressure screenings. I'm going to jump into the COVID cases, just because in the last 30 days, we've only had 5 reported cases, which obviously is not much at all. But then again, as we know, those are reported cases and not people testing at home, which could be a much larger number. But overall, it's going down. We're waiting on the new vaccine to come out so we can kick up the mobile clinics again. So that's later on in the fall. So that's for COVID. I didn't see any clusters
Okay.
in Maven, so at least not in the last month. So I think it's been pretty quiet in Grafton.
Dan.
Dan?
Yep. Yep, this is Dan Finn. I've had some personal hearsay contacts with a number of people that have traveled internationally in a wedding, where I have heard of a bunch of cases, or several. I'm talking about 10 or 12. Wasn't like some double-blind study or something, but anyway, so personally, I would suggest, and professionally, that people that are 65 and older and any immunocompromised folks get that third booster, just from hearing a little bit of bump from people.
Yeah, I know some people not super close that were positive, but came in contact with people that were positive. Thankfully, they themselves never ended up being positive. But yeah, it's definitely still out there, which is why we keep it. I'm not gonna drain it when we get to the COVID topic, obviously, because we're covering it now, but it's definitely still out there. And echo what Dan was saying about the booster, and then also, wearing a mask if you're in that population, or you come in contact frequently or live with someone in the population of 65 plus, immunocompromised, et cetera, because it's
maybe-
definitely still around.
Right, or maybe on a plane or on the line or something. Thanks.
Yeah, and it's the same guidance that hasn't changed, and it probably won't for a while, as we wait for the new vaccine to
Mhm.
come out. So, yeah.
Anything else,
I think
Amelia?
that's it, yeah. I think that's it. We're continuing to send out monthly topic of the month
Mhm.
flyers. Hopefully are posted everywhere. And like I say, these topics are based on calls we get, inquiries we get at the health department, and don't necessarily match the national health topic of the month.
It makes sense. They're timely. Like, I think, what was it, last month was the sun one, or skin, I forgot which it was now. I'd have to go back to my notes. But
Yeah,
Yeah.
skin cancer, we're on ticks this month,
Yeah,
we're
which is
doing
very timely.
mosquitoes next month. Right, starting to get calls on that.
yeah, you're not going to
And
put a
then
mosquito
probably
one
get
out
into
in the middle
flu.
of December in Massachusetts. I mean, you could, but it doesn't seem like it's the most timely thing to talk about.
Right. Probably be ignored, but yeah, so, yeah, I think
Anything
that's it.
else, board members, for Amelia or Micah, obviously? Without anything else. All right, and if not, thank you both. As long as no one objects, I'm going to, so Jennifer doesn't have to sit here while we talk about other topics that aren't the opioid settlement funds. I'm gonna jump the topic, skip a couple topics and jump down to the opioid settlement funds, because I know everyone's busy, and I'm sure there's other things that the Alliance members and Jennifer, et cetera, can obviously attend to. So rather than sit around while we talk about other things that don't impact specifically. So we're bringing back, this was the meeting that I had to miss, but there was discussion because Grafton's getting a bucket, like many towns and communities are, of settlement funds from Massachusetts for the opioid settlement funds. And I think during the last meeting, there was just a brief discussion, kind of to kick off the discussion, as it were, as to these what types of topics, what types of restrictions. I'm assuming, we're all assuming that it's not just like we can use this money, whether it be this year and upcoming years, for whatever the town wants. There's some type of guardrails, certain types of programs, et cetera. And so we wanted to get more of that information, because we know we're going to have to at some point, like, talk with the school department and see what else, and who else might benefit and be able to use some of these funds. So,
Yeah.
Jennifer,
Yes. I
you
guess,
were recommended by Solo as the person that can at least help us get the ball rolling further in terms of these discussions.
yeah, I guess I can speak to what we have done with other towns around this, in regards to what Grafton would do with the money. I think that in other towns, we have convened different stakeholders, whether from the schools or the police department, right? Or a parent, to come together, discuss what are the emerging issues in Grafton right now, right? And so I think before we decide what to do with them, and I think it would be good to find out what is Grafton in need of at this point. I know from our meetings with the schools, right, there's a big focus on mental health, right? From middle schoolers and high schoolers, through COVID, and now there is an increase in youth reporting struggling with mental health, what is it that we could do in Grafton to help combat that? For one of the towns, for example, they chose to hire a mental health clinician to be part of the police department for correspondence as they do get cases. So it's just a suggestion, but I think we need to look at what is Grafton in need of currently. For other towns, they have chosen to partially pay for a recovery coach, right? Somebody with a lived experience who has had both mental health struggles and maybe substance misuse struggles as well, to help work with youth and other people in that town to move that work forward. So I think I would pose the question back to you to find out what are the issues in Grafton, right? Does it make sense to see who could speak to in Grafton to bring people together at the table to discuss what is Grafton in need of, then find out if that's allowable. But I think right now, our suggestion would be to brainstorm a little bit more with different people at the table around this topic to efficiently use the money.
No, makes sense.
Yeah. And I know for Grafton in the past, you have worked with Shrewsbury Youth and Family Services. I'm not sure if right now you still subcontract with them for mental health services and counseling services within the schools.
Board members, opening it up to you in terms of thoughts, questions. Oh, Dan.
I don't know what I just did there. Can you hear me?
All I
Okay.
know is people shifted on my screen when exact same time whenever you did.
I moved everybody around.
You moved everyone around, at least on my
Music-
end, which is fine. I'm done introducing the list of people, so you didn't mess me up during the middle of my introduction.
Musical chairs, I guess. Yeah, I'm sure the schools are paramount and very important, and, you know, getting in touch with the superintendent or the principal will help to try to direct some funds and see what their thoughts are. But I also, again, I don't know the statistics, maybe they're available through the Department of Public Health, Massachusetts, but it seems to me, in regards to local, relatively local overdoses and maybe even suicides or whatever, but that there's a range of people from 25 to 40 years old. And I don't know how you reach those folks, unless maybe through a gym or a YMCA or wherever they might go to work out or something or other, just to get some kind of poster up that there is help available, or to try to get to that gang. If anybody thinks of any, or Jennifer, if you think of any way to reach out to that group, but it's pretty sad. Over the years, I have to look at the obituaries a lot, and they don't specifically say the cause of death in a lot of cases, but I just know there's a lot of 30-something-year-old kids, and it'd be nice to try to get to them somehow. I call them kids.
Jen, I saw your
Yeah.
hand, your virtual hand up.
Thanks, Dan and Karen. I was actually thinking, I wonder if it would be worth us trying to reach out to Evan and maybe getting together some folks from the school, some folks from the police department. I don't know if there's any providers specifically in our community that does like substance use treatment. And again, as Dan was saying, getting a little data about, you know, is there a specific drug that's an issue in our area? You know, in addition to the schools and just, you know, again, making pathways, of course, for mental health and substance use. Are there opportunities for teaching parents on recognizing the signs and things like that? So I don't know if it's worth us trying to do like a little bit of a, I don't know if we've done like a subgroup kind of thing like that before, to try and gather some data and hear directly from people that may benefit, but also gather a little bit of data about our community, as Dan mentioned.
Yeah, I mean, I think it's definitely something worthwhile.
Right. I think that makes sense. I can only speak to the data that we have currently, which is specific to middle schoolers and high schoolers, right? And mental health has just spiked in within the schools. And I think most recently they wanted to do some work around why is that, right? We have the numbers, we can see it's going up. What are the actual issues where should we focus our intervention, right? So I can speak to that data that we did for the survey, and we are administering another survey in the spring. So it'll be good to see where our youth are after COVID, right? But in terms of other numbers, in terms of overdoses, I think it'll be interesting to see where those are. I imagine they're also high. I'm happy to speak with our commissioner who does opioid prevention work to find out what those numbers are from Mass CPH for Grafton as well. But I would agree with Jennifer in regards to convening a subgroup to talk more about this.
Agree, because it's like, don't want to sit there and go like, yeah, we're going to put all the money this year, let's say, into X specifically, middle schoolers. I'm just throwing something out there. Middle schoolers, mental health, nothing to do with substance abuse, nothing to do with the 25 plus population like Dan mentioned, et cetera. And then find out that it's mental health, yes, but there's substance abuse. And what about the high schoolers and so on and so forth? It's not like we're only talking $1,000 total or something where there's enough, I don't remember the figures, but potentially enough to be able to kind of split the puzzle, as it were, and approach different things. Now, mind you, obviously, if it was going to be a situation, not saying we, the Board of Health, but the town, the police department was going to hire someone full-time, part-time, et cetera, then obviously that a good chunk of money would go obviously towards that, because of the fact that you're talking not just a program, you're talking someone's salary and everything too. So, all right. I don't know. I think Jennifer, your hand was up before Amelia's, but.
And just to add to that, I think that as we do this work, there are so many people who fall between the cracks that we don't reach out to. So I don't know the makeup of Grafton right now, right? But I can tell you that for the schools, folks that identify as LGBTQ, right, are more likely to struggle with mental health and substance use, right? I may need more help. So maybe looking at those specific populations that we otherwise miss as well will be helpful for us to do for Grafton, to ensure that we target folks that we otherwise don't typically engage with or think to help.
Agreed. Amelia? If you're talking, Amelia, you're on mute. Nope. There you're off. Okay. You still there, Amelia? Bill, I saw your hand go up. Now you're on mute.
I'll master it sooner or later. I think in addition to getting a sense of what the salient issues are, I think we need to do an assessment of what the existing resources are. I think one of the things that I think we would like to avoid is either duplicating or competing with services that are already in place. It would be more advantageous, I think, to actually try to augment existing services. I have no idea what the mental health resources are in the schools, but I'm sure they could use additional resources, and you could conceivably joint venture with larger entities like Riverside Community Care or one of the other, larger mental health facilities that might be able to supplement or augment what is already being done. I don't think it would be wise to try to create a new program without knowing exactly what programs actually exist.
Yeah, I absolutely agree, Bill, that I think the police department has something too where they, refer folks or, people can connect with. I don't know all those pieces as well as what the school has. I think absolutely those are, what are our issues? What do we have? Where are the
What are their ideas? Yeah.
Right. Where are we having gaps, if you will? you know, even just getting people into treatment, is that a gap? Is there a pathway for those kinds of things? But absolutely, that's my thought as well.
Amelia, you back?
Okay, am I back?
Yes.
Okay, good.
I'm like, is it on my side? Because I just had another
I don't
good
know
crack
what
of
is
thunder.
going on.
So.
There's a gremlin in my computer. So I was thinking we have interns working on flyers and handouts all the time, and we can have do some research and come up with appropriate flyers for any of those topics. Also, we have a health fair coming up in Grafton in the fall, which, you know, that would be a nice place to give handouts. And also, I'm having the DA's office come in doing opioid updates at some point this year. We're still scheduling to the senior center, and we could do other locations, maybe a school or two. So there are a few things going on that we can work with. So Jen, we can talk about all that too. That was my 2 cents.
Jennifer?
Sorry, I wanted to ask about the faith-based organizations in Grafton and what role they could play. I know it's very difficult to reach out to parents, but maybe just going where they're at would be an easier way for us to reach out to them. So maybe the churches, possibly.
Yeah, there's definitely a variety of churches in town. So. Yeah. Oh, Dan?
Yep, this is Dan. So Jennifer, I did it again. Jennifer N. I think it might be a good idea for you to, or someone from your office, to check in with Chief Crapo at the police department. He may have somebody, I bet, I imagine, on his team that's kind of specifically the go-to person when they have to refer it to somebody. They go to a domestic situation, just to see what resources they already have. And that would be pretty helpful information over the next month or two, I would think.
I can do that, definitely.
Appreciate the dialogue and discussion. At least we're getting it continuing to move forward and kind of get the ball rolling further and brainstorming and. Oh, Bill?
Yeah, this is Bill Muller. What sort of funds are we talking about? I mean, is it like $1,000, $10,000, $100,000?
I don't remember off the top of my head how much now, but it's multiple years worth.
Yeah,
And I also don't know, because I haven't seen all the financials. I also don't know, like, if it's, I'm just throwing out a number, do not quote me on this number. If it's 50,000 for the first year, is it 50,000 for the next each, say 5 years or 10 years? Or is it like 50,000 bolus this year, and then it's like 5,000 for the
if
consecutive
it's a
years? That
startup grant or something, yeah.
I don't know. That I don't have info on, but it's definitely not $1,000. Let's put it that way. I don't know if it's $100,000 either, but
It's about $62,000
Okay.
for the next 20 years. 62,000
A year.
by year. Yep. Yes.
Yeah.
which is how that explains how, like, the town was able to hire a mental health clinician in one town and be able to use, you know, that's why I said, if it's $1,000, then I wouldn't know how anyone would be able to hire a mental health clinician for very long. So yeah, so we're talking a good amount of money. And also, if that's that many years, even if it wasn't 20 years, honestly, that's still a lot of years, even if it was 5 years or 10, where we could put something in
Right.
place substantial that
Right.
can continue year over year. Not saying we want the exact same topic every year, because who knows in 5 years, 10 years, 15, 20 years, what's going to be the problem and the concern of the time. But at least mental health is always going to be a concern. There's always going to be substance abuse. It may be a different drug that's the biggest concern at the time, but there's always going to be mental health, no matter what age. There's always going to be substance abuse of some way, shape, or form. We know that's going to be the case. I mean, that's the way history's been. So at least if we can figure out something for resources and programs, whether it's augmenting, obviously, what's already in place, or if there's something that we don't have in place that we can start up and use the funds towards, that then can be, as time goes on, changed to like covering the substance abuse at the time, or the concern if it starts to be less youth mental health, and maybe it's skewing a little bit more to say the population that Dan mentioned, the 25 plus, how do we approach that without ignoring, because there's always going to be mental health issues, no matter what the age range is. I can guarantee you we're never going to do a survey of middle school and high school and be like, nope, no one in middle school and high school has mental health concerns at this point. Because we don't want to make it be totally focused on a different population as time goes on either, because there's always going to be concerns. So it's figuring out how we do that.
Yeah, this is Bill Muller again. I think it really is important, though, to get a sense of what the existing resources are. I mean, this is a significant amount of money, and if it's guaranteed money over that duration, then it's really the challenge is really to take best advantage of it.
Yeah, I mean, I think there's even opportunity, Karen, to your point, to do something more like a, every couple of years, a grant sort of proposal, so that it's open, if there's multiple people that could benefit from it, and try a few different things. It's a big opportunity, I think, if we have more information.
Agreed.
I'm sure you'd love to run a grant process every few years, but just a thought. Doesn't have to necessarily be a one-time decision of what we do for 25 years or whatever.
Anything else, anyone, at least at this point in time?
This is Austin. Just a quick question. What sort of time frame are we looking at to sort of get these funds distributed? Is it kind of urgent? Like, should we have this meeting in the next month, or could we do it probably like 2 or 3 months? Because I think getting everyone together within a month or so might be kind of tough.
Yeah, that would be my thought too. Yeah, I don't know, Jennifer, and since if you know anything specific around like timing, like is there a cutoff, or like is someone in our accounting department in town just like literally getting a bolus of $62,000 and then it's up to us whenever we so choose to start using that? Or is it like the state says you have to start doing something and using these funds by X date, otherwise? Yeah.
So I think the previous email came from the finance director from the town of Grafton, Mary LaLuria. I guess as we have this conversation, it will be great to have her as part of the brainstorming as well, because I think she can tell us exactly what Grafton got and what's allowable and what the timelines are.
And how we have to go about this, because I know enough to be dangerous in terms of expenses and budgeting in town that certain types of things have to be submitted a certain way, et cetera, et cetera. So we wouldn't want to go down this path and then be like, yeah, we're gonna hire just because you use it as an example of one other town, we're gonna hire a mental health clinician related to the police department, and then find out there's some process that was skipped or something along the way. And now, it's all those things that we normally, none of us here ever have to worry about when it comes to those types of expenses and budgeting and posting, and even just how you submit those expenses through the town.
Right. So I think it'll be useful to have her as part of the conversations, because I think it's different per town and the amount of money is different per town as well.
Yeah. All right. I appreciate it, everyone. that, like I said, we at least get the ball rolling and stuff, and we can circle back and try to figure out the best way and best time. Because yeah, right now we're in the, not saying everyone's going on vacation, but it is school's out. It's vacation season for a lot of people. Trying to get a group together and get like the whole group with representation, I don't know, could be surprised. But we can push to start having that kind of cross-functional group discussion sooner than later. Anything else? If not, then I think we can jump back up to the topics. Thank you, Jennifer, for joining us. Really appreciate it. And providing some insight and thoughts, and including even what others are doing. It just sparks some ideas, obviously, for us. So we appreciate it.
Thank you for having me. Thank you.
All right, COVID. At this point, I think we already covered the COVID topic, so there's no point in rehashing what we just discussed. So we will jump down to the proposed bylaw updates. Pretty much at this point, I think we'll just keep this on as a monthly topic. There might be months where there's no updates that were done, not because like we talked about last month, it's not like we as the board have a lot of parts of the bylaw that'll get touched. We have the biomedical regulations, which the last update when we saw from last month had just a few small things in it. And then we have the plastic bag reduction and the polystyrene. So those I know are supposed to be getting looked at. The two, the biomedical had already been looked at, but the plastic bag and the polystyrene. I think Nancy had said that those were kind of on the docket, that they're going to be looking at those next. Doesn't mean there's going to be any changes beyond little minor tweaks, but just something we should obviously, where we are the owners, as it were, the enforcers of those, that we definitely want to take a look at once those updates have been proposed, to make sure that we're actually in agreement with them. I mean, if they're minor little ones like the biomedical, then it's not a big deal. But if there was anything more substantial, obviously we want to make sure that we, as the board, who would have to enforce those, would be okay with that, and that we don't see any concerns, because we're not the ones involved in making the actual updates. So just something we'll keep on the radar and continue to review as time goes on. Because I just wouldn't want to see us, if there was ever something that it goes through whatever the process is going to be to make those updates final, and then we end up getting stuck, for lack of a better term, with something that we don't agree with. And now we have to enforce or change how we enforce and didn't know it. All right. Oh, Dan.
Yeah, Karen, this is Dan. Do you happen to know what their timeline is to sort of finalize and pass any new bylaws? I'm thinking it must be 2 or 3 months, but I don't know.
They've been working on it for some months now already.
Right.
And chipping away at them.
So maybe towards the fall town meeting or something like that.
Maybe that's the goal, is to have everything kind of finalized, hopefully before fall town meeting.
Thanks.
All right, that was all we had for actual topics. Minutes, we're gonna have to pass over. There was an issue getting the minutes files created and finalized and sent out in time. So I just said to Nancy, rather than sending them out an hour, 2 hours or whatever before, knowing we're all busy, and then most likely none of us having time, or only 1 or 2 of us having time to review them before the meeting, let's just pass over those for now, and then we can include them in the next meeting. So she'll be ahead of the game when it comes to getting them done for us. Mail and correspondence, I saw something quickly from her when I was checking email right before, just quickly, that the Mass Department of Public Health had announced that West Nile was confirmed as being detected in mosquitoes in Massachusetts for the first time this year. And it was in a mosquito sample collected July 6th in Brookline, Massachusetts, which is in Norfolk County. So not really close to us, but just, I know Nancy said she was gonna post that because of where it was the first confirmed mosquito in the state. She posted that to the website for the Board of Health. And obviously everyone's continuing to monitor because it is the season. It was something I was going to cover under old and new business, that it is tick season, it is mosquito season, take all the proper precautions for both of those if you're out and about. Fingers crossed we'll have another not major West Nile or Triple E season again this year. But I've heard that ticks are definitely seeming to be a higher amount, folks are saying, than recently. And as we all know by now, ticks don't just carry Lyme disease. There's other diseases that, over the years have become more prevalent in the area, unfortunately, beyond just Lyme disease. So definitely take precautions against both ticks and mosquitoes throughout the season, because we're still early on, let's put it that way. Bill?
Sure.
Oh, there you're on mute.
I will get it sooner or later.
Don't feel bad, I did it at work today.
Yeah. I do think with all the rain we've received recently, there's clearly going to be more of an issue with mosquitoes.
Mhm.
Probably in 2 or 3 weeks from now, there's going to be a lot more. We've gone through a couple of years where we've had relatively dry summers, and I don't think we've had quite as much in the way of problems with mosquito-borne illnesses, but I think we're definitely going to have more of a problem this year.
No, I agree. I said past couple of years, it was the offset for the COVID pandemic that we didn't, we didn't get the Triple E and West Nile major concerns, but we had COVID to deal with instead. So, there's no guarantees. I'll call it that we lucked out the past couple of years when it came to mosquito-borne illnesses and stuff. So.
Right.
Dan, was that you wanting to speak, or is that just your hands sliding?
Yes, I could have spoken. I hadn't muted myself, but yeah, thanks, Bill, for that reminder. Tomorrow morning, I'm going to empty 3 buckets of water that are in the corner of our house that doesn't drain well. And there's probably a foot of water in them. So anyhow.
Especially after today.
I know, it might be overflowing. So thanks.
Amelia, I see your virtual hand up.
Yes, so I send those reports to Nancy on a weekly basis. So that's information that I could cover in the meetings if you like.
Yeah, I mean, if you want to, where it is the season, obviously we're happy to get the reports on a weekly basis still, because a lot can happen in a month between our meetings. But yeah, I mean, be happy if you want to cover that when we meet also,
Right.
just to give us an overview.
Yeah. That one just came in yesterday, today, of the one positive sample. So, but Grafton, like the rest of our Alliance towns, we're still pretty low in terms of risk. So we're
Fingers crossed it stays that way.
we're okay for now. Yeah, fingers crossed.
All right, so old, new, we just covered ticks and mosquitoes. I just wanted to bring up for the board members that there were the model regs for private wells and septics for both of them had some changes to it. I know we didn't put a definitive time for when we wanted to bring it back up, but just a reminder, because at some point sooner than later, we can put it on the agenda once folks have had a chance to review, so then we can discuss if we want to proceed with either or both, updating of the wells and the septics for our regs to match those of the model, or potentially even parts. Doesn't mean we have to follow if it's a model reg like that. So just then, if we choose to do that, then we have to go through the appropriate process for getting those updated. So just a reminder. If you want, I can ask Nancy to send those back through both of them, so that way we don't have to all go fishing through our emails to try to find when she sent those. Bill?
Unmuted. Do we have any jurisdiction over the water department?
No.
I'm sure
They're
most people.
private entities.
Yeah, we got this notice that there had been some, problem that, they just wanted us to be aware of. But I'm not sure, I mean, it does seem that it would make sense for us to at least have some input with them. I mean, I don't, I guess it's just a private enterprise that
It's come up in the past.
has Grafton's name on it and.
Yeah.
Yeah. And there are different districts, right? South
Mhm.
Grafton.
Yeah, because I have South Grafton Water.
Yeah.
But,
And it was discolored this week, right?
yeah, I didn't notice anything in my area. But I know there's definitely, I see it on Facebook, not as much South Grafton District, but definitely more frequently Grafton's, like
Yeah.
the Grafton Water District, which is Grafton and North Grafton. You see every so often there's an uptick in like the brown water complaints.
It was more yellow, actually. But
Yeah, some of the pictures looked yellow. Someone showed one, I was like, ooh, kind of looks like mud.
the sales of Poland Springs went up immediately.
I can just imagine. Hopefully Stop and Shop had plenty of water. Yeah, no, it's come up in the past around whether there was any involvement we could have. I'll call it that. Dan?
Yeah, just, it would be good to find out who regulates them. There must be some either state or federal regulation that would look at water testing, I would think, but I have no idea.
All of the water testing, I believe, is monitored by the Mass DEP.
I think so.
Okay.
Yeah, they send out those reports, I think,
Mhm.
annually of what levels of chemicals and things like that are in our water.
All right. So that's all I had for old and new. Oh, that's right. One other thing. In case anyone on the board has not taken their conflict of interest training yet, please take your conflict of interest training. On behalf of the town clerk, because I don't get the reports anymore. On behalf of the town clerk, if you have not taken them anymore, have not taken it, please take it.
Went right to the final deadline. I think it was July 3rd or 4th or something. I got it done.
All right, so other than that, upcoming meetings, August 7th, we currently have as a hybrid, September 11th as remote, October 2nd as remote, November 6th is hybrid, and December 4th is hybrid. All right, so that's all we had for the agenda. So there's nothing else.
Did we have some minutes we were supposed to approve?
Now, we had to bypass them because
Postponing that. Yeah. This is Dan.
they weren't ready yet because I pretty much told Nancy, I'm like, just, there was an issue with the files and stuff. And I'm like, just rather than send them out an hour or two before the meeting and none of us are like, one of us gets a chance to review them, we're just going to end up having to bypass over them anyways, because there won't be enough time.
Is there a sense of how we got so far behind in minutes?
COVID. Literally, Nancy was working overtime just to keep us afloat during COVID, and then all the permitting and all the other septic, et cetera, all the day to day. So something had to go by the wayside, so it ended up being the minutes. And now she finally has time with Beth also being part-time in the office to actually be able to start chipping away, not start, she's been chipping away on them for months now, but chipping away and getting like a handful or more done each month. Dan?
I guess I'm looking forward to spaghetti and meatballs because I'd like to make a motion to adjourn this meeting.
Is there a second?
This is off the magnet. I'll second the motion to adjourn the meeting.
All right, roll call vote, everyone.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwiazdowski Govin, aye. Thank you, everyone.